Hello, my name's Laura. I'm the Programme Lead for the London Dementia Clinical Network. And for the next 5 minutes, I'm going to be talking about our National Memory Service audit. Now, the audit originated in London. In 2015, we did a pilot audit of services and then an audit in 2016 and 2019. And it was at that time we decided to offer the audit to services across England. Now, the audit consists of organisational questions such as, do you have a name lead for young onset dementia? And then it's a case note audit of 50 consecutively seen patients. In 2019, 85 services across England participated in the audit. And to put it into perspective, I think there's about 220 memory services in England. And this contributed data to 4,000 patients. Now, in England, most memory services are part of mental health trusts. So what did we find? Well, we found variation between services throughout the memory service pathway. We also found some services had a lack of opportunities for joint working. So in 20% of services, there was no opportunity for joint working with neurology, and this increased to 30% for neuroradiology. And when there was joint working, it was often only ad hoc advice rather than, for example, formalised multidisciplinary meetings. And looking at assessment practices, so overall 59% of patients were asked about their hearing, and we found this varied between services. So in some services only a few patients were asked about their hearing, and in other services all patients were asked about their hearing, and it was similar picture to vision as well. Overall, we found in 50% of cases, it was deemed that a scan was not needed for the diagnosis, and we found this varied between services from 0% up to 92%. Looking at the diagnosis, so of the group age 65 and over, overall 17% were diagnosed with mild cognitive impairment, and this varied between services from 0 up to 47%. We also found variation in subtype diagnoses between the different services. Now, of the nearly 4,000 patients in the audit, only 11 people were diagnosed with frontotemporal dementia. So this represented 7% of the young onset dementia group and 0.3% of the 65 years and over dementia group. Looking at post-diagnostic support, so 3/4 of services reported that they could provide cognitive stimulation therapy, but when you look at the actual numbers of people that were offered the service, it was only 46% across these services. More patients were offered a dementia advisor at 81%. So just to kind of give you an example of the variation we saw, so this looks at the percentage of carers who were offered psychoeducation, which is recommended in NICE guidance. So as you can see on the left-hand side, in some services, no carers were offered this service, and then it raises up to 80–90% of carers being offered this in other services. In January of this year, we held an event for the services that participated to look at the findings and discuss areas for quality improvement locally, regionally and nationally. And here are some of the key discussion points. So it's felt that creating local memory service forums would be really useful to share practice between services. There was a recognition that we need to improve joint working. So I talked about neurology and neuroradiology, but also geriatrics and Parkinson's clinics. We need to improve physical health assessments within memory services. Overall, we found that only 17% of patients consented to be contacted for research, and services felt that having a consent to contact research script would be really useful. And services felt having training and education on frontotemporal dementia would be really useful. The audit showed we are potentially under-recognising this group. So I've given you a snapshot of some of the audit findings. You can read all the findings in our report. So there's a link there, or if you just Google London Dementia Clinical Network, you can find the report there. Thank you very much for listening.